Preparing instructional assistants to be effective team members. Instructional assistants are very important people. IAs, or instructional assistants, make valuable and worthwhile contributions to the overall instructional program and to individual children's lives. Using people-first language. Words and language have a strong impact. Keep in mind, a student is a person first. The disability is a part of them, but not who they are. Address them as a student who has a disability rather than as disabled or handicapped. Here are some examples. For example, say a child with autism instead of autistic child. Say a person who has instead of afflicted or suffers from. Say uses a wheelchair instead of confined to a wheelchair. And a student with a disability rather than disabled or handicapped. Every student has an individual education plan or IEP. This is their individual instructional program. There are goals and objectives, as well as some students may have a behavior plan if their behavior impedes their learning or the learning of others. Everyone, including instructional assistants who are working with the student, need to have access to the IEP. Who makes up the IEP team? There's always an administrator, parent, teacher of record, service providers, which may be a general education teacher, occupational therapist, physical therapist, consultants, etc. Parents can also invite an advocate. The case conference committee, those individuals making up the IEP team, meet minimally one time a year at the annual conference to go over the student's progress on the goals and objectives. At that meeting, they will also write new goals and objectives for the coming year. Disability awareness. What do those different eligibilities mean? Learning disability involves ongoing problems learning key academic skills, including reading, writing, and math. It's usually identified during elementary school years, although it may not be identified until later. Autism spectrum disorder refers to a range of conditions characterized by challenges with social skills, repetitive behaviors, speech and nonverbal communication, as well as by unique strengths and differences. We know now that there is not one autism, but many types caused by different combinations of genetic and environmental influences. The term spectrum reflects the wide variation in challenges and strengths possessed by each person with autism. Emotional disability is a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behaviors or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. Other health impairment is another eligibility area, which means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment that is due to chronic or acute health problems such as asthma, attention deficit disorder or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, etc. All of these or one of these would adversely affect a child's educational performance. There are other disability areas. Another one is developmental delay. That is primary for our students ages 3 to 5 that attend our developmental preschool program, as well as students in kindergarten, first or second grade. Deaf and hard of hearing, blind low vision, orthopedic impairment, multiple disabilities, language impairment, and or speech impairment. Team building. The instructional assistant as a member of the special education team. Clarifying roles as an instructional assistant will prevent misunderstandings and problems. Communication is essential to ensure a successful program. The teacher is the lead, and you are a team member. Your role is to support the teacher to meet the student's needs. The teacher provides direction and planning. Instructional assistants work under the direction of the teacher, provides feedback to the teacher, follows district and school policy and procedures, provides individual instruction where necessary, and may need to provide supervision under the teacher's direction, and most importantly, will foster student independence. Communication is very important. It helps to build trust. The teacher will always communicate with the parent. Instructional assistants communicate with the teacher. Ask for clarification if needed. It is okay when you're working in the classroom and working with students to offer suggestions to the students, and students' needs are always the focus of our communication. When you work with others, always put yourself in the other person's shoes. Be open to new ideas. Be confident in who you are. Be someone that you would like to work with. You are a team member. Most importantly, smile, laugh, and have fun. Next, we're going to discuss effective strategies for working with students. Make sure you're always following the teacher's lead. Provide only as much help as the student needs. It's very easy to provide too much help for the student. Use the student's name. Be professional. Stay in control. Let students know that you care. Use short phrases. Many times, too much talking and verbiage overwhelms the student and they're not able to understand and listen to those long phrases. So use short, concise statements. Facilitate student interaction when appropriate. Students can help one another. Encourage language skills and catch students being good. Also, model, lead, and check. Make sure the student's understanding. Facilitate and fade. Try to divide your time to meet the needs of all students who need you. Use wait time. Allow students time to do the task before jumping in. And make sure students have the materials they need. Confidentiality is very important. All personal, identifiable information, whether it's written or verbal, is confidential about the student. Special education records are confidential. A parent consent must be obtained before sharing personally identifiable information. Discussing a special education student with a neighbor or your family is illegal. Next, let's talk about behavior. Understanding positive behavior intervention. I'm going to talk about some techniques that may not be used. You cannot cause physical pain. You cannot use noxious sprays. There is no denial of food, water, physical discomfort, bathroom use. No verbal abuse, ridicule, humiliation. No locked seclusion. Students must be adequately supervised at all times, and you cannot deprive a student of one or more senses, for example, vision or hearing. For the behavior, an IEP team may need to initiate a functional behavior assessment. A positive intervention plan is written. You may need to document behaviors for the functional behavior assessment. Rely on your teacher for those forms and direction regarding specific documentation. A behavior plan is a legal document that is part of the IEP and required when a student's behavior is impeding their learning or the learning of others. Positive behavior intervention. It's looking at the behavior in a new way. It's making sure you understand the behavior, changing the behavior, implementing intervention strategies, and those behavior intervention plans. Behaviors from a student can be a signal for the student having little control over their environment, whether at home and or school, having few choices, poor social skills, poor communication skills, and sometimes a change in medication. Problems with punishment. When we punish students for their behavior, that may actually reinforce negative attention-seeking behavior patterns. It may confirm the student's own poor self-concept. It can reward noncompliance by increasing peer status. It increases student resistance by setting up power struggles. It also doesn't address the root of the problem. It doesn't work for students with serious behavior problems. Punishment does not teach appropriate behaviors. It's reactive rather than proactive, and sometimes we have to wonder who's in charge. What's the message? Making sure that we have careful observation and documentation. We need to look at what happens before the behavior occurs, what happens after the behavior, when does it occur, who does it occur with, what do we think the student is trying to avoid and or seek, what need or function of the behavior is being met, and what is in it for the student. We need to teach the student appropriate behavior. We need to teach students appropriate ways to get their needs met. We need to teach them replacement behaviors for the inappropriate behavior. Problem solving, new solutions. Staff need to be consistent, follow the plan, and stick with the plan. Remember, when strategies are being provided, the behavior may actually increase before it decreases. Looking to prevention. Always make sure you're observing the environment. Look at your own behaviors and those of others, the when, where, how, before, and after. Do not get into a power struggle with a student. Be in control, have a flat affect, and an even, calm voice. Avoid crosstalk when working directly with the student, particularly when the student is anxious or in an emotionally elevated state. Make sure classroom and interactions are positive. Structure and consistency is in place. Implement de-escalation strategies from CPI training, the nonviolent crisis intervention. You cannot talk a student out of behavior, particularly when the student's emotions are elevated. During periods when emotions are elevated, be brief, be clear, and be calm. Avoid threats of any nature, whether that's punishment, negative consequences, telling parents of behavior, etc. Do not become repetitive. Don't keep saying to the student the same thing over and over. Raise your voice only in the event of a dire situation when it's necessary to immediately gain the student's attention to avoid a dangerous behavior. For example, injuring themselves or another person, running into the street, or touching a hot stove, etc. And remember, you are an important and valued member of the team. The job of the educator is to teach a student to be independently as a functional citizen to the best of their ability. Our job is to make ourselves obsolete. An instructional assistant who helps a student to become independent is a highly desirable employee. Be very careful to avoid judging anything about students and their families. Students and families are often perceptive of such judgments and often throw up barriers when they believe they are being judged. Such judgments are often expressed in thoughts or statements beginning with, "If I were his parent, I would." Control your emotions at all times. Students, even those with very limited cognition, are often most perceptive of your emotional state and will respond to your emotions. And always facilitate student independence. Thank you.